Can a layoff trigger PTSD? Can a layoff trigger post-traumatic stress disorder? The answer is yes, it can. For many individuals, losing a job is not just a financial setback. It can feel like a significant traumatic event. This is especially true when the layoff leads to the loss of essential resources such as income, housing, and social support. Research indicates that job loss can be a strong predictor of long-term PTSD. It often sets off a chain reaction of economic, psychological, and social stressors that can lead to chronic emotional distress. For instance, studies have shown that individuals who lost their jobs after traumatic events, like the September 11 attacks, had much higher chances of developing PTSD compared to those who remained employed. Layoffs are among the most stressful life experiences, comparable to other major stressors like divorce or the death of a loved one. The workplace environment during layoffs can also contribute to PTSD. Factors like job insecurity, negative relationships with coworkers, and the trauma of sudden unemployment can increase the risk of developing PTSD. Interestingly, it is not just those who are laid off who may suffer. Employees who remain in the workplace can experience symptoms like anxiety, depression, and survivor's guilt due to the instability created by layoffs. This can harm overall morale and productivity. From a clinical standpoint, whether someone develops PTSD after a layoff often depends on how they perceive the event. If they view the layoff as a threat to their security and resources, the trauma can be more pronounced. The uncertainty about future employment and financial stability can compound this trauma. The psychological effects may linger for years and can lead to increased risks of depression, substance abuse, and even serious health issues. To manage layoff-related trauma, early intervention and prevention strategies are essential. Workplaces can implement measures such as open communication, mental health support, and counseling services. These strategies can help reduce the psychological impact of layoffs and assist both those affected and those remaining in coping with the trauma. While not everyone who experiences a layoff will develop PTSD, evidence suggests that layoffs can indeed trigger PTSD in vulnerable individuals, particularly when they involve significant resource loss and ongoing stress. Addressing this risk requires awareness, supportive workplace policies, and access to mental health care.